Hello, everybody, and welcome back to Marsha J's Medical Terminology Simplified channel. So, for the month of July, or at least what's left of it, it's not much left in the month of July, we'll be exploring the digestive system, otherwise known as your gut or your stomach. The digestive system, also called the gastrointestinal system in medical language, or GI for short, it is comprised of a digestive tube called the GI tract. The digestive process begins in the organ of the mouth and ends in the organ of the large intestine. There is a 7-step process for the digestive system, and it begins at the mouth, or oral cavity as it's known, demonstrated here in number 1. And once food is broken down from the saliva and from chewing, it moves through your esophagus. And that is this big long pipe that connects from your mouth to your stomach. And your stomach is where food is stored. And it's broken down further by acid and enzymes. From there, food moves to the small intestine. Anything that's left over from the small intestine moves to the large intestine. And the large intestine is also known as the colon. Did you know that the intestine is like a 5 to 7 foot long muscular tube that connects the small intestine to the rectum? And the rectum is responsible for waste and stool. It takes about an average of, say, 36 hours for a waste or stew to go through the rectum, through the colon, excuse me. It goes through the colon, it exits the rectum, and goes through the anus. The digestive system is jam-packed with a lot of medical terms. And that's normal because the digestive system or gastrointestinal system, it has many parts that make up the digestive system. Parts like the small intestine, the large intestine, and many, many other parts. Some of the basic medical terms I'll go over are the word like gastro. So we have the prefix gastra with the vowel of O. Gastro means stomach. A medical term used with gastra is gastralgia. Algia is the suffix, which always means pain, and gastra again means stomach. So gastralgia is defined as stomach pain. Next, we have pharyngo. Pharynx means pharynx or throat, and using the vowel of O, pharyngo, means pharynx. A word defined as pharyngitis. The medical term for pharyngitis means inflammation of the throat. Next, we have sialo. Sial means saliva or salivary gland, and using the vowel of O, you have sialo. The medical term here is sialolith. It is pronounced sialolith, and that means it's a calculus or stone in the salivary gland. The small intestine consists of these medical terms. First, you have duodenal, the prefix of duodeno. Either pronunciation, duodenal or duodeno, is correct. And duodenal means duodenum or duodenum. Duodenum is defined as the first part of the small intestine. Next, we have entero. Entero in the digestive system means intestine. Entero. And the medical term of enteropathy is defined as disease of the intestine. Jejunal is defined as the jejunum, and the jejunum is the second part of the small intestine. And last, we have ileo. Ileo, and not to be confused with the spelling ileum, I-L-I-U-M. Yes, sometimes in medical terms, the words are pronounced the same, spelled differently, and have a different meaning. So the spelling of ileum, I-L-I-U-M, that means that's part of the hip. But here in the digestive system, ileum, spelled I-L-E-U-M, that is defined as the third part of the small intestine. These are just some of the medical words that make up the large intestine of the digestive system. Here we have colo, the prefix col with the vowel of O is colo, and that is defined as colon. A medical term using colon, you have colonoscopy. The suffix oscopy is always defined as visual examination. So the term colonoscopy means visual examination of the colon. Sigmoid, O, sigmoid is the prefix using the vowel of O. Sigmoid O means sigmoid colon. The medical term used, sigmoidotomy. The suffix otomy is always defined as incision into. So sigmoidotomy means incision into the sigmoid colon. Next, we have append O. Append is the prefix using the vowel of O. Appendo means appendix. The medical term here used is appendectomy. Again, ectomy, the suffix ectomy always means surgical removal of. So appendectomy means surgical removal of the appendix. And there are other parts of the large intestine demonstrated here in this image, such as the transverse colon. You have the descending colon, you have the ascending colon, you have the cecum, the appendix is right here, this little thing right here, that's the appendix. And that's where the jejunum is. And then it comes down to the sigmoid colon, this part here, all the way down to the anal canal. So here we have a few diseases, disorders, or conditions that comprise the digestive system. And you see my little friend down here, she's looking like she's not feeling good. So I guess she's going to try to decide or or go to the doctor so the doctor can decide which one of these disorders or diseases she may have. She may or she may not have. Anyway, so first one here is Crohn's disease. Crohn's disease is defined as a form of inflammatory bowel disease, or IBD for short, resulting in swelling and dysfunction of the intestinal tract. Next, we have gastroesophageal reflux disease, better known in the medical world as GERD. And guess what, y'all? All GERD means is heartburn. You just have heartburn. But the official medical term for heartburn is gastroesophageal reflux disease. And it is defined as the backflow of gastric contents into the lower esophagus, allowing flow of acidic juice into the esophagus. Next term is hematemesis. The suffix for this, emesis, always means vomiting. The prefix hemat always means blood. So hematemesis is defined as vomiting of blood from bleeding in the stomach or the esophagus. Obstipation. Obstipation in the digestive system is defined as severe constipation, which may be caused by an intestinal obstruction. And last we have ulcerative colitis. That is defined as chronic inflammatory disease of the colon, which can commonly begin in the rectum or sigmoid colon, and it can extend upward into the entire colon. This, of course, is not the whole list of medications used to treat conditions or disorders of the digestive system. These are just a few of the commonly used drugs, such as antacids. And antacids are used to relieve symptoms of GERD, again better known as gastroesophageal reflux disease or acid reflux or heartburn as it's known. And there are a lot of antacid meds, mainly over the counter, and I think there are a few prescribed. But some of the antacid meds are milk of magnesia, Tums, and Gaviscon. The generic name for Protonix is pantoprazole. It is pronounced pantoprazole, and pantoprazole is in the class of drugs considered a proton pump inhibitor used to treat a disorder called erosive gastritis, as well as other conditions involving excess stomach acid. Now you may ask, what in the world is a proton pump inhibitor? It's simply a medication taken by mouth, and it's either dispersed as a tablet or a capsule. It also works by irreversibly blocking an enzyme, and this enzyme is also known as the proton pump, which is found in what's called the parietal cell. And the parietal cell is defined as responsible for gastric acid secretion of the stomach wall. Other PPIs or proton pump inhibitors are medications like the generic omeprazole. The brand name for omeprazole is Prilosec. And lastly, there's sulfasalazine. It is pronounced sulfasalazine. It's a medication used to treat a couple of things, such as rheumatoid arthritis, but for the digestive system, it is used to treat irritable bowel disease, or IBD. Okay, everybody, that wraps it up for another edition of Marsha J's Medical Terminology Simplified. I hope this video was a help to you, and I hope it brings you one step closer to learning medical terminology. Don't forget to like and subscribe to my channel.